video number 2 regarding a second doctor visit from yesterday. This is for my youngest daughter. She has a pediatric cardiologist, and we went to see her yesterday. So we are managing her. Obviously, we're looking to make sure that her triglycerides and her ALT and her AST are stay within a manageable, let's put it, limit, because we don't want it to get too high. The big part of seeing our cardiologist, as you know, just a little bit background when it comes to having TSC, you can have tumors that are growing in your heart. So obviously, as a TSC patient, you will see a cardiologist. So with my daughter, my youngest daughter, when she was born, she did have them in her heart, which were absorbed by the bloodstream. So just a little background here. But still, it's really important to stay on top of that. Really important to just kind of make sure that there's no issues. Typically, after they are absorbed, you shouldn't have any issues. It's not very common, but it's still a good idea to kind of give you guys the information to ensure that your child is constantly being monitored, at least once a year. But with my youngest, right now she's on a pretty new medication called everolimus. The everolimus is being used. We see a hematologist for it, specifically because we need to just keep it on top of all of her blood work, make sure that the medication isn't affecting her negatively. Also, because of the kidney, we want to make sure that there's not adverse reactions to the medication when it comes to how it affects her kidneys. Also, making sure that we keep on top of her triglycerides, make sure that her AST and ALT are manageable. Again, we'll go back to that. So her numbers are kind of within the range. We want to make sure that they stay there. They're a little high, but they're manageable. So the doctor, the cardiologist, does not want to put her on any heart medication. Doesn't want to put her on anything, obviously, because it can affect all her other medications. Also, it could have an adverse reaction where it's not the best thing for her. So stay away from that, especially as anybody that is on any type of blood pressure medications. You already know how hard it is on the body, how hard it can be on you overall. But again, we're trying to stay clear from that because we just want to manage it right now with health, with just making the right choices when it comes to foods that she takes or she eats. Doctor recommended that she focuses more on eating fish, chicken, grilled chicken, obviously healthy rices and beans. Stay away from anything obviously unhealthy, which is any fried foods, saturated fats, as we discussed before. And again, that's all comes to play when, like I discussed in the last video, it's really important that you manage your health properly in order to not only for remaining healthy, but also we have other health risks where my youngest does. She has the issues that she has with her kidneys. We want to keep an eye on that, make sure that they stay healthy, as well as making sure that the medication she is on, which is the everolimus, has no other adverse reactions where that could affect her in a negative way. Where it is shrinking her tumor in her brain, we want to make sure that it's not impacting her kidneys, impacting her health anywhere else, right? Where it's raising her blood pressure, or so. Again, we go back to, hence why we get monitored. When it comes to her hematologist, we get monitored on every 6 months. She sees her hematologist. After she gets a MRI once a year as well to check the tumors in her brain, and we'll talk about that on the next video. So you can find out a little bit about my youngest and how TSC has actually affected her when it comes to her brain. So my youngest, the TSC affected her the most in her brain, unfortunately. And again, thanks for listening. Don't forget to subscribe. If you have any questions, join in the fun. Let's discuss what you're dealing with, and please understand that, again, I just want to make sure that I reiterate this. I'm not a doctor, I'm not a nurse, do not have a background in medication. This is all just real life experience. Thanks again for listening in. Hope you have an amazing day. And don't forget to focus through and evolve. Ciao.